This is a 2023 update of the video on TMJ, or temporal mandibular joint, or jaw Botox. So I want to sort of tell you my evolution of where I am today regarding TMJ treatments, or just Botox for the jaw. So I started doing this 20 years ago, where I was just slimming the jaw to make it narrower, which I still do. And so this video is talking about those that want their face slimmer and those that are suffering from pain or discomfort from TMJ, such as myself. I am also someone that has received Botox treatment. In fact, I just got mine last week using the newer method. So this video will talk about those that want their face slimmer, those that are suffering from pain, clicking, all those things, and those that have both. And I'm going to talk about two targeted methods to address this. So classically, the way to inject a wider face is using a concentrated amount in a very perfectly distributed location in the masseter muscle. The masseter muscle is the muscle that extends around the bone itself. So we're going to talk about that method, and then we're going to talk about the method for pain control as something different. And then I'll hopefully give you a better idea of how I use each method. So first of all, the classical method of masseteric reduction I've been doing for 20 years. I do it very, very precisely. In the masseteric reduction, I use a concentrated amount in the tail of the masseter where there is a wider area. And it takes about 6 weeks for that area to shrink. Most people that don't have a very, very large masseter, I usually do every 6 months. And what I've noticed is that over time, they need less and less and less. They need fewer, less often. Sometimes it can go every 9 months, sometimes every year, but it's not always the case. So that is one type of injection. It takes a little while for it to improve. You should see that area looking better. Does that help with TMJ pain? Yes, sometimes the reason you have a large masseter is that you clench and grind so much that that muscle gets really large, and it can absolutely help with pain. The difference, though, is with this traditional method is that it doesn't usually occur immediately. It takes a few weeks for that improvement, and not always does it get as good an improvement as the other method, which I'll talk about. The risks of this procedure are very minimal. There's certainly no long-term risk, but short-term risk, I've had about 5% of my patients, when they bite down, they see a little bulge that comes out, stays about 6 weeks. Very easy to fix. If you live in Dallas and you're having me treat it, I just inject it with a few units and that shrinks it down. And if you don't, it usually goes away in about 6 weeks. The other is about 1 or 2% chance of a smile, where when you smile, it's slightly off. It's the fact that the risorius muscle is sitting right in front of the masseter. In rare cases, I can see that. That goes away oftentimes in 4 to 6 weeks as well, rarely 2 months. And that's about 1 or 2% of the cases. So no really long-term risk with this treatment. The other method that I use started actually through a very novel understanding. This is something that I'm probably the only one in the world doing this, because I invented it, and it's something that no one else really understands. I have lectured on it extensively, but it's something that people have not adopted. I don't think they understand it as well as I do. And so this method is specifically treating pain. It's not going to shrink the size of your face. It is mainly specifically for pain. And the reason I started this method is many years ago, I did a lady that had some discomfort from a facelift, and I couldn't fix it. I put a drop of Botox, the pain went away. And then about maybe, I forgot how many years ago, I had a gentleman come in, and he was in incredible pain. And I've been doing already that time Botox into the jaw for years, and he had no fullness. It was completely thin, and he had so much pain, and I said, I don't know what I'm going to do. I mean, I traditionally injecting his masseter, I don't think it will help because it's so small. I thought, well, what if I marry this concept of pain control with this technique? And that, over the last few years, I've evolved and evolved and evolved, and it's gotten better and better and better. So the technique that I use is actually, in the past, I would put in 5 or 6 injections. Now I'm putting in 10 to 30 injections per side in very specific tendinous points. I call it a tendon release. It's just my name for it. I'm actually palpating or feeling areas. Like right now, I still feel I'm a little tender here. I know where to go. I've done this so many times a day, that I know exactly where to go, even if you can't guide me. Although traditionally, I have you guide me. And the way that it works is I put a little drop of Botox in, and this is hyper dilute with a lot of little points. The other one is hyper concentrated for masseter muscle treatment. And the injection is little droplets all over the entire face in the exact points where you have discomfort. And the way it works is I actually try to elicit a little pain. My other technique, you don't feel anything. This one, I'm actually trying to elicit a little bit of pain, and you'll get to know how to do this once I start it. But once I pull back that little bit of pain in that region, I know I've nailed it. And it's pretty crazy because it doesn't actually make a lot of sense, but the pain from the Botox the pain from the TMJ is immediately gone. So I know it worked because you don't have to wait weeks. You don't have to even wait an hour. It's instantaneous. In fact, when I do one side, you feel this complete relaxation that's pretty darn incredible. And people say, how does it work this way? I don't know, but it does. And it usually gets better after a couple days. So I want it to be at least 90% improved before you walk out the door, because I know it's going to give me a little bit better kick in the next 48 hours. In some patients, there's a little area where you feel like, actually it got worse. Well, it didn't get worse. What happened is I knocked down 80 or 90% of the pain, and there's a couple points that you didn't declare until it showed up a week or two later, and there's no charge for that touch-up. Come in and let me treat it. This treatment usually lasts 3 to 6 months. It's sometimes a little less than my other treatment for debulking, but I've found, just like everything I do, is that the more I do, the longer it lasts, the better it works. And so if you don't quite get full relief, which hopefully you do, over time you get better and better outcomes. So what I usually divide my patients into, oh, by the way, the risk is, I don't see the lump issue. That's about 5%. You can have it, but I've never seen it. A little bit of smile issue is possible. It usually is is a little bit more risk if I go farther anteriorly. To me, if you're in a lot of pain, it's worth a little smile off being for 4 to 6 weeks, but it's not that common. But when I deal with patients with pain, I really want to treat the pain, and I tell them the risk as I go forward. And even if I don't go far forward, sometimes there's some temporary smile issues. But that's something, it's not that common, but the relief is absolutely incredible. And sometimes it's related to pain in the neck or other areas which I do treat. I do charge extra for those other zones. It can maybe into the temple and back of the head, and those zones are charged separately from the TMJ region. So if you are in a lot of discomfort or having clicking, popping, I can actually knock the clicking, popping and about 95% of patients immediately off. It's like gone. And not 100% of patients get that relief. Most people get that clicking, popping gone immediately. And it's instant. It's instant release. So the way to understand which method would you need, if you're in it for just purely cosmetic purposes and it's the same price for either method, then I would just do the debulking. If you're in a lot of pain, I would really do this other method, which is very, very powerful. If you have both issues, I can do both the same day, but I will have to charge you each method separately for that treatment. What I've noticed in those patients that get both methods is that oftentimes after I've debulked the muscle, it doesn't come back toward fullness over time. It usually stays down if I can hit it a few times, so that you start to need fewer and fewer treatments. As I told you, that the pain treatment does oftentimes in the first treatment or two last a little shorter than the debulking. The debulking usually lasts 6 months, not always, but the other treatment usually 3 to 6 months. So I usually, for a pain treatment, have you come back in 3 months. For the debulking, usually 6 months. For the first, at least for the initial treatment. With ongoing therapies, I usually find that it works better and lasts longer. You need fewer treatments of it. And any little minor touch-ups I don't charge you for, but I do have you understand if it's only lasting 6 weeks to 2 months, I do charge you for another session. But I want you to understand is that is not something usually patients need to continue with that frequency. It's something that extends longer and longer unless you're in the most severe case. So if you are having one method or the other, I will tailor it to which one. I'll give you some advice. If you say, well, what if I have a bulky face and I have pain and I don't want to pay for both, I want to do one. So if it's severe pain, I will tell you probably do the pain method. But sometimes the bulk of the face needs to be reduced. So sometimes if you said, look, I want to pay for only one method and your pain is not so severe and you have more bulk, I may just do the debulking method, because if the force of the muscle is reduced, then that is something that can be very helpful to overall provide greater longevity. That's a tailored thing that I have to spend the time and talk to you about so that we can make decisions about. Recovery-wise, besides some of those limitations, there's really no recovery time. I mean, there can be mild bruising, mild swelling, but it's typically very, very negligible. I would not say that's a major issue at all. But that's something that I would recommend one way or the other, or both, depending on your situation, plus or minus other areas of pain in the neck or in the back of the scalp. If you're having migraines, if it's causing issues, I can treat those other areas as a separate cost. For my patients that are having anything that is still there, it's not quite relieved at a week or two, I really, really encourage you to come back, let me manage the situation. So I don't want you to be in pain. This is something very unique. Until you've had this treatment, you really don't understand how this is different from what your dentist is doing or your neurologist or whatever it may be. This is, for pain relief, it's a very targeted solution, and I have very loyal following, because other places they're just randomly shooting at a few master muscles, or they're shooting some random things in your scalp. Absolutely different from me. I'm so focused on this treatment, and the difference with what your neurologist is doing or someone else is doing, where they're getting a little partial relief, maybe at a week or two, and you're still having pain, is that this is instant relief on the pain. Now, people always ask me, the question is, do I need to stop wearing a night guard or some kind of protection on my teeth? I would say no. I still wear it. I get Botox and I still wear it, because there is no way that I can reduce all the pain from the treatment. The night guard is still very important in my opinion. I just saw a gentleman this last week. I told him another treatment, just so you know this, sometimes it can be a parotid hypertrophy. Parotid hypertrophy basically means that there's a bulk that sits out here. I've not had a lot of those patients, but I've had a few. Usually the cause of it is bulimia. When you were younger, maybe in college, when you threw up a lot or whatever it may be to stay slim, you get these parotid hypertrophy, and they don't go down. They can stay large. I had a lady a couple years ago that when I did it, she actually had some weird swelling for about 6 weeks before it went down. So now I'm just warning patients, if I do it, there could be some weird body reaction to it. But long term, my goodness, she has never come back again. I've done her facelift, I've done her fat transfer. Her face has stayed slim now for a few years. So to me, parotid hypertrophy usually has to do with something in the past. The gentleman that I saw this last week, he didn't have any of those things. He wasn't a bulimic, didn't have any issues. But there's a very defined, I can see it and I go, that's not master, that's parotid. I know what it is. And that parotid treatment, yes, temporarily there could be some smile issues or maybe some weird swelling if you had some abnormal issues with the parotid, but that treatment works really well. Now, if you've got a unilateral, in other words, one side being swollen like this, well, it could be a tumor, in which case you need a CT scan. But if it's been two equal sizes, they're not tender, they've been there for many years, then I'm not so worried about, a cancer or anything. Of course, I encourage you to always, have it checked out by a doctor. But if they're just two equally sized, big parotid sizes that look bad for years, that's one other treatment that is distinguishable. You usually can see it. It blunts out the mandible angles here. It's just sitting way wide here. Very rare that I see this. I've probably only treated a handful of patients over the last 20 years, but it is worth making that distinction. If you come in and you say, hey, Dr. Lamb, I listened to your video on TMJ treatment, and it wasn't, and now you tell me it's a parotid. Well, it's the same cost. It's just a different method of treatment. And in my experience in those few handfuls I've treated, is very, very long-term in terms of improvement. So hopefully this video on TMJ treatment, which is a very unique method, really covers sort of the ideas of how to treat this and my philosophy toward it, and the unique method that I use.